Hi guys, welcome back to Meds Made Easy. My name is Tarun Verma with Health First Specialty Pharmacy. Today we're going to talk about Bupropion, also known as Wellbutrin. It is for major depressive disorders, all kinds of depression-related disorders. Seasonal depression too, which is interesting. Yes, that actually exists. When the seasons change, a lot of the population tends to go through kind of mood swings. They don't understand why. We don't even have a mechanism to make you understand why it happens. It just does. It's a phenomenon we see. And also smoking cessation. This is one of the antidepressants you can use to help you quit smoking, and it is quite effective. It's a good medication for that. Okay, so let's get into it. Dosages they have immediate releases, they have sustained releases, they have extended releases. If you're on the immediate releases, you're going to be taking it several times a day. If you're on the extended releases, sustained releases, you're probably going to take it twice a day. Doses vary again. I'm not going to go into the doses. That all depends on what your diagnosis is and also what strategies your doctor is comfortable prescribing it at. They don't really know too much on how this one works, which is weird. Yes, that's very disconcerting. However, a lot of medications that work in our brain, we don't quite really understand how. We just know that when we give it to the population, we get this response. Therefore, we think it works like this, so we make connections. It essentially kind of works by increasing norepinephrine and also dopamine as well. Generally takes about 1 to 2 weeks for it to kick in, kind of like any medication does when you first, any depression medication does when you first start taking it. Generally, you don't see a good effect for at least a week to two because it's got to saturate in your brain. It has to sort of readjust your neurochemicals. Your body has to get used to it. All of that kind of takes a little bit of time. So about 1 to 2 weeks before 2 weeks till you see, I think, really the bulk of the effect of the medication. So don't stop it after a week if you're going, it's just not working for me. Don't do that. Keep taking it. Now, if after a month you're going, I don't see a difference, then yeah, call your doctor. That's a conversation you guys should have because maybe the medication is just not working for you. Let's see here. It does have a black box warning for suicidality. It's very odd, it's very unusual, but yes, it's a depression medication. It's supposed to make you happier, but at the same time, there is an increased amount of suicide thoughts that happen in people from time to time. So if you yourself are taking it and you notice it, or someone you love is taking it and you notice that they're a little bit having these thoughts, they're a little bit more down from time to time as usual, then you need to kind of bring that up to the doctor because that is probably a side effect we need to get kind of like addressed right away. It does go through your liver and your kidneys, so if you're on additional medication that go through those things, make sure your doctor knows so that we don't overstress those systems. It is a pregnancy class C medication, which means it can be used, but it should be used in caution. So there's sort of like if the benefit outweighs the risk, then you take it. Again, this is a conversation that you should have with your physician. It is also present in breast milk, which is not necessarily a big problem, but there is something called an RID, relative infant dose. So, at that point it'd be your pediatrician. Your pediatrician would have to kind of monitor the breast milk to make sure that there's not too much of the drug in there and it's not getting into the baby. But little amounts are okay. So just, again, make sure that everyone's on the same page. Your physician's roped in there. They're constantly testing you while you're breastfeeding to make sure that it's all good. Here's a list of the side effects up. And yeah, so again, whenever you go to stop the medication, the big thing to know is that you have to taper off. So take a little bit less over a period of time. Usually the withdrawal, the taper system is about 2 weeks. So you're gonna take a little bit less each day, or after a few days, you're gonna cut the dose down a little bit more. And because you gotta get your body used to it, because if you just stop taking it, you're gonna get withdrawal symptoms, really bad headaches, your mood is gonna go haywire, and you don't want those kind of things. We wanna prevent that from happening. As far as the smoking cessation goes, they don't know exactly. Again, I hate making these videos and telling you, well, we don't know why it happens. We just know that in practice, in clinical practice, we just see a response. But with smoking cessation, they don't know exactly the mechanism by which someone stops smoking on this medication. But they're saying that there's a large link to the fact that if you were to stop cold turkey smoking and you're, however many packs smoker a day and you've been smoking for years, you're gonna get a little depressed. It's gonna make you down, right? Because the nicotine, you have less nicotine in your body, you're less activated, you're more depressed. So taking an antidepressant kind of counteracts that. And while no other antidepressant really has that effect to reverse things, bupropion does, which is why we see it we see it as like one of the first line therapies of like smoking cessation. So, which is a pretty cool thing. But yeah, so that's kind of the link that by the medical community thinks that it works. And so yeah, I wish I had a better answer for you. I wish I could get really scientific with you on how exactly it curbs your appetite, your smoking appetite, but we don't. We just don't know. Beyond that, guys, I think that's it. Pretty easy stuff, really easy stuff. It's been around for a while, a really good medication. Leave us comments down below, give us a like, subscribe to the page. We're really trying to put out good with these videos, and we'll see you next time on Meds Made Easy. Bye.